Imagine a world where can AI diagnose diseases with incredible accuracy, but we don't have any idea how to reach its conclusion. And let's look at abstract. So, what is explainable AI? AI that can explain its reasoning and decisions. Contrast with traditional black box models. Why is interpretability important in healthcare? Because patient safety, understand why a diagnosis was made to prevent errors. Trust, build trust between patients and healthcare providers. Ethical decision making, ensure AI is used responsibly and fairly. And regularity, meet healthcare regulations requiring transparency. For an example, disease diagnosis explain how AI identified specific disease, treatment recommendations, understand these factors influencing, and for choices, drug discovery, explain how AI identified drug candidates. So, coming back to introduction, so imagine a doctor recommending a treatment on a complex AI algorithm, but you don't have any idea. Explainable AI is crucial in healthcare to ensure transparency, trust, and ethical decision making. Why? This is XAI that AI can explain its reasoning and decisions. Contrast with traditional black box models also. Why is interpretation important in healthcare? As previously said, patient safety, trust, ethical decision, and regularity. And for example, in basis, identify specific disease and mainly recommend for treatments also. And what the need of explainable AI in healthcare. Hans, imagine an AI system making a critical decision about your health, but you don't have why? Because explainable AI is essential in healthcare to ensure transparency, trust, and ethical decision making. High stake decision making, AI can significantly impact patient outcomes. Trust is crucial, and trust requires understanding legal or ethical implications, local laws, and ethical considerations. Make XAI essential. Clinicians must understand these tools they use for patient safety. Benefits for explainable AI improve patient safety. Understand AI can prevent errors, increase trust, transparency, and also ethical decision making. Ensure to AI is responsible and fairly. So, Dhiru will start next part.
Okay, thank you, Madhji. So next we have techniques for explainable AI in healthcare, model agnostic approaches. So LIME, local interpretable model agnostic explanations. LIME simplifies complex models by approximating them with interpretable local models. So this helps in understanding how specific decisions are made by focusing on individual predictions. uh, SHAP provides a way to explain the output of any machine learning model by assigning importance scores to each input feature. It uses game theory to attribute contributions to each feature, providing insights into which features are most influential in the decision making process. Model specific approaches, decision trees. So when it comes to decision trees are inherently interpretable because they use a series of simple rules to make decisions. So each decision is based on feature thresholds, making it easy to follow and understand how conclusions are reached. Next, attention mechanisms. So attention mechanisms are used in models like neural networks to highlight which parts of the input data are being focused on. So this helps in understanding which aspects of the data are driving the model's predictions. So much move on to next slide, please. Next, we have applications of explainable AI in healthcare. So first, diagnostic tools. AI models in imaging. AI is increasingly used to identify patterns in medical images such as X-rays or MRIs. For example, in cancer detection, AI models can highlight suspicious areas and assist radiologists in making more accurate diagnosis. So explainable AI helps ensures that these models are transparent, allowing clinicians to understand how decisions are made and increasing trust in the AI's recommendations. Next, we have treatment planning. Uh, it means predicting treatment outcomes. AI can assist in developing personalized treatment plans by predicting the potential outcomes of different therapies. For instance, AI models can analyze patient data to recommend the most effective treatment options based on historical outcomes. Explainability in these models help healthcare providers understand the relational, the rationale behind the suggested plans and make informed decisions. So next we have prognostic models like progression prediction. AI is used to predict the progression of diseases such as sepsis by analyzing patient data and identify early warning signs. Prognostic models can forecast how a disease might develop, allowing for timely interventions. Explainable AI in these models ensures that predictions are transparent and interpretable, aiding clinicians in understanding the risk factors and making better informed decisions. Madhushi, move on to next slide.
Okay.
Next, we have challenges and research gaps in XAI for healthcare. So, accuracy, interpretability trade off. So, high accuracy often means less interpretability. Finding a balance is challenging, and context specific explanation. Current XAI methods are often too generic. We need explanations tailored to a specific clinical context and patient needs. User centric design. Explanations must be designed with end users in mind, clinicians, and patients. Effective XAI needs to be both understandable and actionable. Next, move on to the next slide, please, Marji. Next, future research directions. So first we have enhancing human AI collaboration. Design AI systems that support clinicians while allowing them to retain control and oversight. Developing next we have developing context-aware explanation. Uh, Create XAI models that offer explanations tailored to specific patient and clinical contexts. Next, we have integrating the effectiveness of XAI. So evaluate how XAI. This part actually evaluate how XAI affects clinical outcomes, decision making, and also the patient engagement. So let us talk about the conclusion part also. Marci, move on to next slide. Okay, as the conclusion part of our research, integrating XAI in healthcare is vital for building trust, transparency, and effectiveness in decision making. And progress has been made, but challenges persist in balancing accuracy with interpretability, creating personalized explanations, and assessing real world impacts. So, future research should aim to advance these areas to unlock the full potential of AI in healthcare. So, that's it from our research, and thank you.